In today's video, we'll be discussing about the third step of the nursing process, which is planning. You must have gone through the previous 2-3 videos which were about the step-by-step nursing process, and in which we have already discussed regarding the assessment and then the diagnosis part. Now today we'll be discussing the third part, which is the planning part of the nursing process. Now, first of all, we'll be looking about the definition of the planning. So, planning is a category of nursing behavior in which client-centered goals are established and interventions are designed to achieve the goals. So, प्लानिंग हम उस चीज़ को बोलते हैं जो अभी हमें एक्चुअल एक्शन से पहले जो हमने अपने दिमाग में इमेज बनाई है, कुछ स्टेप्स अपनी जगह पे सिलेक्ट किए हैं जो हम अब इंटरवेंशन फेज में अप्लाई करेंगे पेशेंट पे, लेकिन अभी हम बस प्लान कर रहे हैं कि विच इज़ रिक्वायर्ड फॉर अ पर्टिकुलर पेशेंट. So in that way we can say it is actually a category or group of nursing behaviors जिसमें एक नर्स जो होती है वो क्लाइंट के नीड्स के हिसाब से, उसके गोल्स के हिसाब से सेट करती है सर्टेन इंटरवेंशंस, सो दैट कि जो पेशेंट की प्रॉब्लम है वो सॉल्व हो जाए और गोल अचीव हो जाए. So planning is defined as the development of the strategies designed to alleviate the client problem. So in planning phase, a nurse actually prepares a plan of the interventions which she applies on the patient so as to provide appropriate care and to alleviate the client problems. So let us now see the purpose of planning, why we need to go through this planning phase. To determine the goals of care and the course of action to be undertaken during implementation phase. सो प्लान हम इसलिए करते हैं सो दैट हम स्टेप बाय स्टेप पहले प्लान करें कि हमें इंटरवेंशन फेज या इम्प्लीमेंटेशन में क्या करना है. इन दिस वे हम एक तो कंटिन्यूटी ऑफ केयर प्रमोट करते हैं और इस वे में हम पेशेंट की नीड्स को अच्छे से आइडेंटिफाई करके उस नीड के हिसाब से इंटरवेंशन सिलेक्ट करते हैं और फिर इंटरवेंशन फेज में उसको वो केयर प्रोवाइड करते हैं. Planning helps to allow for delegation of specific activities. फॉर एग्जाम्पल अगर हमने प्लान किया है कि हमारे पेशेंट को फीवर है एंड ही नीड्स कोल्ड स्पंजिंग, सो वी कैन डेलीगेट दिस रेस्पॉन्सिबिलिटी टू द अटेंडेंट or some other person, because we might be busy with other patients, so we can delegate this responsibility to either the attendant or the caregiver or to some other person. So give direction to client care activities. Planning gives direction. Once we plan what actually we have to do, then we follow the same steps. And after our and after providing the same care, if the patient's condition is improved, then our plan will be successful and goal will be achieved. And if the problem is not solved of the patient, then we again frame a different set of activities or we plan it again for the same patient. Now, let us see about the components of planning. The planning phase or the planning step, it consists of 6 components. First one is setting priorities, then establishing client goals and outcome criteria, then planning nursing strategies, writing those nursing orders, and then actually writing the care plan, and then finally consulting. So during planning phase, the first thing is we set the priorities. We have actually collected the data in the assessment phase. We have diagnosed the problem of the patient. Then among those diagnoses, we set the priorities. Which one is more important and which is to be dealt first. After setting the priorities, then we establish the client goal. What we want to achieve by providing specific intervention or by planning specific intervention. That is actually establishing client goal. For example, if our patient is having a problem like hyperpyrexia and we have to establish client goals, In that way, what we actually do, our goal will be to maintain normal body temperature. So, which will be our outcome criteria also. Then, for that goal to be achieved, we plan nursing strategies, and we plan various strategies how we can achieve that goal, how we can maintain the patient's body temperature to normal, or how we can lower the patient's body temperature. Then once we plan those strategies, we actually write them in a sequential way and we frame the nursing care plan. And then finally we consult again. Whatever we have written, is it appropriate as per the patient's problem, or do we need to add some more interventions? So now let us see the various types of planning. So planning is basically, we say usually of three types: initial planning, ongoing planning, and discharge planning. We will discuss them in the upcoming slides. So let us first see what is initial planning. So initial planning is actually the planning done immediately after the initial assessment. Uh, in previous lectures, you have heard about the initial assessment. So in the same way, we frame the initial planning. After doing the assessment for the first time of the patient, once the patient is shifted to your ward or the patient is admitted to your ward, the assessment which you done at the time, and after doing the assessment, the diagnosis which we frame and which you prioritize. For that diagnosis, what kind of plan you are doing, that will be the initial planning. So this initial planning is usually done at the time of patient admission and at the time of initial assessment phase. In initial planning, it must start early because of the trend towards the shorter hospital stay. So initial planning जब भी आपको करनी है, आपको बहुत quickly and immediately करनी है once your patient is admitted in your ward or you have received a new patient, because आपका पेशेंट ऐसा ट्रेंड है कि आपका पेशेंट ज़्यादा देर हॉस्पिटल में नहीं रहेगा. सो इन दैट वे, जितनी जल्दी आप इनिशियल असेसमेंट करेंगे, उतनी जल्दी आप इनिशियल प्लानिंग करेंगे, उतनी जल्दी आप इंटरवेंशन प्रोवाइड करेंगे. द सेकंड पार्ट ऑफ प्लानिंग इज ऑनगोइंग प्लानिंग. सो ऑनगोइंग मीन्स जो चलती रहती है. So ongoing planning is done by all the nurses who give care to the client. Since the initial planning is done by the one who receives the patient for the first time, and once her shift is over and another staff comes, she goes for her own continuity of care. Then again comes the third staff. So ongoing planning is actually done by all the nurses who are actually involved in direct patient care of the same patient, and in that way they carry out daily planning by using ongoing assessment, because वो डेली बेस पे पेशेंट की असेसमेंट भी करते रहते हैं एंड अकॉर्डिंगली पेशेंट की ongoing planning भी करते रहते हैं. For example, patient was admitted with a fever and the initial planning was to provide care of for fever, and the person who was involved or the nurse who was involved in the initial planning, she provided accordingly care to the patient, and the patient's fever subsided, and the evening shift staff came, and at that time patient is having the normal body temperature or the patient temperature has lowered. Now he is not having that much of temperature. So in that way she will again the patient assess the patient's condition, check the patient's temperature again, and then accordingly she will plan as per the current condition of the patient. That is what we say ongoing planning. The third phase of planning is discharge planning. So discharge, as name indicates, it is a kind of planning which is done for the discharge of the patient. So discharge planning is the process of planning about the needs, about those needs which will occur after discharge of the client. Because the needs which are occurring during the patient stay, that will come under ongoing planning. And those needs which were present at the time of admission, those will come under initial planning. And but the needs which will arise once the patient gets discharged. Those will occur after discharge of the client, and that is why for that we need planning also, and that is called discharge planning. And this part of the planning is actually a critical part of comprehensive health care, and it should be included in every client's nursing care plan. So you plan regarding the discharge planning, what needs may arise once the patient is discharged, how he has to follow the drug regime, when he has to come for the dressing, where he has to go in case of emergency, where he has to report. So this all will come under the discharge planning. Now the phases of planning. So the phases include the first of all assessment of priorities to nursing diagnosis. In every planning phase, what you have to do, you have to assess for the priorities. In the previous step, in the second step of the nursing process, you have already framed the diagnosis or nursing diagnosis of the patient. Now in this phase you have to again assess of the priorities, which diagnosis needs to be intervened first, and the specification of short term, immediate and long term goals of the nursing action. And among those priorities, you have to see the one which is a short term need, which can be met immediately, the one which is the intermediate, which may take 2 3 days, and one which is a long term goal, which may take longer period of the time. And then after that, you have to identify that identification of specific interventions which will be appropriate for attaining the goals. So first you did the assessment of priorities, then specification of short term, intermediate and long term goals, and then after that the identification of specific intervention. The diagnosis which you have prioritized, what are the various interventions needed for that particular diagnosis, what are the various intervention by which we can achieve our goal. So we have to identify those specific interventions. And then finally, we have to document the documentation of the diagnosis, goals, interventions, and also the expected outcome in the nursing care plan. Now we are actually documenting the diagnosis as per the priority. Then what is our goal? What are the various intervention which we are going to provide to the patient to solve that problem or for that particular diagnosis or to achieve that goal? And after giving such intervention, what will be the expected outcome? All these things need to be documented in the form of a nursing care plan. So these are the various phases of planning. Since in the diagnosis phase as well as in the planning phase, the first step is actually the setting of the priorities or prioritization of the patient's needs or nursing diagnosis. So now let us see what actually the priority means. Priority is actually something that takes precedence in position and that is to be considered the most important among several items. For example, you have a patient in effective breathing pattern and you have the same patient with knowledge deficit. So first priority should be given to the problem which is actually the life threatening, which can be the ineffective breathing pattern, which may worsen the patient's condition. So knowledge deficit may not worsen the patient's condition. So knowledge deficit will come under the second priority. And so priority is actually a decision making process in which we rank the order of diagnosis in terms of importance of the client care. Let us take the same example. Patient is with ineffective breathing pattern and patient is with knowledge deficit. So we have to take the decision among these two diagnoses, that which one we should deal first and which is the most important, which should be dealt immediately. So in that case we will give rank 1 or serial 1, or we can say the rank 1 to the problem like ineffective breathing pattern, and we can push on the knowledge deficit to rank second or the last rank. Most of the times there are confusions among the students or among the caregivers regarding setting of the priorities. So which problem should be dealt first, which should be delayed or taken care later on. So for to avoid those confusions, there are certain guidelines which will help you in setting priorities, either in framing the diagnosis or in planning the activities. So in that situation, the number one will be those which are life threatening situations. They must be given highest priorities. So those conditions where there is a threat to the patient's life, where a patient can die, those should be dealt immediately. For example, you are receiving a patient. Before starting IV line, go for stop the bleeding of the patient. Before cleaning the wound, look for the other life threatening issues and accordingly plan for those care. Then the second thing will be the use of principle of ABC, that is airway, breathing and circulation. So in case of ABC, the first thing is given priority to airway clearance. You have a patient not breathing well, so circulation stopped. In that way, the first priority will be clearance of the airway, either by suctioning or by removing the foreign body or some other, whatever measure is required, or by doing the tracheostomy, whatever is required for the patient. So the main thing is that clear airway first, so that the breathing is enhanced, and then check for the circulation. And the next thing is use Maslow's hierarchy of needs. As per the Maslow's hierarchy of needs, there are certain basic physiological needs which remain at the base and the esteem needs which are at the top. So before going for the esteem needs, or we can say before going for the higher level of the needs, you have to go for the basic needs first, which are the basic physiological needs. For example, need for nutrition, needs for oxygen, need for circulation, the need for hydration, and these are the basic need for sleep and rest. So these needs should be dealt immediately and should be given the priority over those which are the safety needs, esteem needs and other needs. So in that way, for setting the priority, always keep in mind the Maslow's hierarchy of needs and go accordingly. Then the next thing is you have to consider something that is very important to the client. So there may be something which is most important for one particular client. For example, you have a patient, you are receiving a patient with who is having the asthma attack. Providing inhaler, nebulization and other thing will be the priority in that particular patient. So you have to consider need as per the patient's condition also. Then actual problems, which are those problems which are present in the patient at the time of either admission or once at the time of assessment, all those needs should be given the precedence over those which are the potential concerns or risk problems. For example, here I will give you an example of a patient with diabetes. You have a patient with diabetes. In that particular patient, if a patient is not having hyperglycemia, regulation of the blood glucose level will be given the first priority over over the risk problem which may be associated with that diabetes. So in that way, you will first try to manage the blood glucose level, then you will go for health education, then you will go for dietary management and other things. So actual problem always takes precedence over the potential problems. Then the next thing is that some you may receive some patients which are very unstable and some which may be managed, or somehow they are stable. Among those two patients, you have to make a choice. You have to attend a patient one which is unstable. For example, you have a patient with fever and you have another patient who is scheduled for physiotherapy. So among these two, the first priority should be given to the patient with fever before attending to the patient who is scheduled for physiotherapy, because physiotherapy patient may wait for some time, there will be no harm, but we have to maintain the normal body temperature in case of the patient who is having the fever. So these are the some of the guidelines. So further guidelines we'll be discussing in the next slide. So Then again we have to consider the amount of time, material and equipments required to provide care to the patient or the client. So for example, we should always attend to the client who requires dressing change for post-operative wound before attending to the client who require health teaching, because the patient who requires dressing needs a lot of equipments, need a lot of time for doing the post-op wound dressing. So let us finish the patient first who needs dressing, then we can easily provide health teaching to the another patient. So in that way, the priority should be given to uh, those problems which may require more time, material, and equipment. Then we have to, and in another thing is that before collecting equipments for a patient, before doing any procedure, check the client's condition first. You should always attend to the client before collecting equipments. So if somebody asks you for that, you have to go for IV catheterization of a patient. Before collecting the catheter and other necessary equipments which are required for the procedure, just attend a client first, look about his condition, do the initial assessment, and then collect the equipments accordingly. So this was all about the priorities. Hope you must have understood these. Though how to set what are the various guidelines for setting priorities in case of diagnosis as well as in case of planning. You must have understood regarding the planning phase of the nursing process. So thank you very much, and if you like the then share and subscribe.